Good morning, everyone. Thanks for joining us. We'll get started in just a few seconds. We'll wait for a few more people to join us. All right, let's go ahead and get started. Welcome and thank you for joining our community conversation on the future Hornsby Bend Health and Wellness Center. This community conversation will take place in Spanish at 1 p.m. today. Esta plática comunitaria se llevará a cabo en español a la 1 de la tarde hoy. My name is Ivan Davila, Director of Communications and Community Engagement at Central Health. With us today, we have Stephanie McDonald, who is the Vice President of Enterprise Coordination and Alignment at Central Health. We also have Rachel Toranjo, who is the owner representative at Central Health. We also have Ted Burton here with us, Vice President of Communications. And joining us today, we have representatives from BSA Life Structures, our architecture and engineering firm. We have Alan Kitchings and Aaron Fogarty. Thanks for joining us. I'd also like to recognize our President and CEO, Mike Gieslin. Thanks for being here, Mike. And some of our staff who are helping us supporting this event with the production, Yesenia Ramos and Anastasia Sims-Mitchell. Thank you for your help. Before we get started, we'd like to offer a few ground rules. If you have a question during the presentation, please feel free to drop it in the Facebook comments and we'll address it during the Q&A portion of the meeting. If we don't address your question, we will have our experts address them later and send those to the participants who are SVP'd in a follow-up email or answer them in the comment section of the Facebook Live. Thanks again, everyone, for joining. Today, we will share with you information and our progress on the Hornsby Bend Health and Wellness Center, as well as a virtual tour of the center. We will also share some of the engagement activities we've used to involve the community in the planning and execution of this project. I'm now gonna hand it over to Stephanie McDonald, who will share with you some of the background on the project. And Rachel, if you don't mind sharing the presentation. Thank you.
Thank you, Yvonne, and hello, and thank you all for joining us today. We really appreciate you taking the time. It's really exciting. In December 2020, we started in earnest on the design of a new permanent health and wellness center and primary care medical home for the Hornsby Bend community. This process has been data-driven and community-informed, and we really couldn't do it without the work of Rachel Toranjo, our project manager on the Central Health team, along with BSA Life Structures, our lead designers, the architecture and engineering firm. I'd like to turn this over to them so they can walk you through the new clinic plans. It's really exciting, and thank you so much.
Okay, thank you, Stephanie and Yvonne. My name is Alan Kitchings. I'm an architect with BSA Life Structures, and I will be walking through just some of the project basics and then talking about some of the architecture of the new design. For those that are not familiar, or just as a refresher, the project site is Hornsby Bend, which is in eastern Travis County and located near State Highway 130 and FM 969, also known as Weberville Road. It's about 10 miles from the airport and about 12 miles to downtown Austin. Next slide, please. Just to take a closer look at the site, we're on 10 acres of land that is mostly wooded. There's a lot of trees there currently. Daly Middle School is across the street to the north, and then residential neighborhoods to the east, as you can see there. Mostly around on the south and west side, there is quite a bit of undeveloped land. Next slide, please. So we'll take a look at the architecture as it's been taking shape since we last met and discussed this project. Our team has worked hard on the exterior design as well as the interior. This is a conceptual view from the northeast side of the building. And you can see here that there's an entrance vestibule and passenger pickup and drop-off areas at the main entrance, which are covered by a large metal canopy over the drive and smaller pedestrian canopy over the sidewalk, which will provide shade from the sun and the elements. The solid materials of the exterior are a blend of dark charcoal gray metal panels, warm stone colored masonry, and a cedar colored wood panel product, which blend together for visual interest, patterns, and shadow lines. Next slide, please. Natural light has been maximized through the use of large windows in the entrance and public spaces, as well as the high clear story windows shown over the tall volume over the lobby. Energy efficient glass will be used throughout the building. This next view that we're looking at here is the northwest side of that same face of the building. Again, the blend of solid wall materials showcase a warm palette of natural colors and textures, and large window openings provide lots of light and views for connecting the interior spaces and the exterior spaces. There are two large sloped metal roofs that can be seen here in this rendering. These serve as architectural interest, as well as providing a large surface for collection of rainwater that can be diverted into a storage tank and reused on the site for irrigation. Next slide, please. And finally, this is a closer view from under the drive canopy for the main approach to the building. There's wood panel accents that help draw the visitor's attention to the front door, and the canopies overhead provide the shade and protection from the elements during arrival and departure. Next slide, please. The site design concepts, we've listed some potential site amenities. The site design is currently still in development, so those have not been finalized yet, but there's a number of site amenities that are being considered for both active and passive enjoyment, and some of these possible options can be seen here. Next, we'll take a look at the floor plan for the facility. This is as visitors come in through the main entrance, they'll be greeted by from the covered pickup and drop-off area. They'll arrive at the reception desk where staff will be able to help check them in for the clinic, provide information, or direct them to other areas of the facility. There are two separate waiting areas in the lobby with a public toilet and coffee bar station, all open to the public. There are community workstations are located nearby the waiting area where access to computers will be provided, as well as a large conference room that will seat up to 8 people, and offices are being provided for public use, such as volunteer services, private consultations, and training. There's a large multi-function room that will provide flexibility for active uses, as well as a group meeting spaces, and includes a movable partition wall in order to further divide the space when needed. On the clinic side, that clinic contains exam rooms, procedure and flex rooms, and a small lab for blood work, and a centralized nurse team station and staff spaces to conveniently serve all of the patient areas. Finally, the service area of the building houses the mechanical and electrical rooms, storage spaces, and a staff break room, and other spaces that are necessary for the operation of the facility. Next, I'm going to hand it over to Erin Fogarty, who's our interior design lead for the project, and she's going to speak about the interior design concepts.
Hello, everyone. So this slide shows the overall finish palette for the building. Healthcare grade materials will be used throughout the building that are durable and cleanable and provide a safe environment for the staff and the visitors. The color palette was inspired by the local community with cool blues and grays from the surrounding lakes, along with warm oranges and golds from sunsets that will create a welcoming environment. The materials that were selected have a timeless aesthetic and will be long lasting. Strategic pops of color on the walls throughout the building will assist with easy wayfinding for visitors. There are sustainable materials, for instance, rubber flooring that will be used to promote wellness and provide comfort underfoot for staff. Next slide, please. This is the rendered floor plan that shows where all the different flooring types will be installed. The purposeful change in materials from public spaces to patient areas will promote easy wayfinding throughout the building. Carpet will only be installed in waiting areas, conference rooms, and offices, while patient care areas will have resilient, durable flooring that has an easy maintenance program. There'll be warm wood look planks that will highlight the care team area and also create easy visibility to visitors. Next slide, please. This is a rendering of the clinic area, also the care team station that Alan mentioned. This area will consist of warm, inviting wood tones and pops of color. And all these colors are again inspired by the surrounding community. Next slide. This is a rendering of the lobby space as you walk into the building. You'll be surrounded by views to nature with the large windows. There's timeless calming finishes that including those warm wood tones, textured carpeting, and a custom biophilic wall or green wall behind the reception desk that brings nature inside. Porcelain tile flooring will line the path of the walkway for people throughout that lobby space. Next slide. And finally, this is a rendering of the waiting area, one of the 2 waiting areas. And these will encompass comfortable seating with a wall that's designated for custom artwork, and the open floor plan from the lobby to the waiting area allows for clear sight lines across the room for visitors. And that ends the interiors portion. I'll hand it over.
Thank you, Erin. Since we launched this project, we've engaged the community very thoroughly through systematic community engagement methods. Our goal in community engagement is to involve residents in the planning, implementation, and evaluation of central health projects. As you can see on the screen, these are some of the tactics that we use to engage with residents to gather feedback. We then rely on communications and outreach tactics to ensure we're involving our consumers in the public participation process. Specifically, to inform and obtain feedback from consumers and patients, we use online and paper surveys and one-on-one interviews, either in person or over the phone. In the case of this project, we did an online survey and we also did telephone interviews, and we'll talk about that in a bit. To inform and obtain feedback from the community at large, we use our community advisory committees, and these are composed of highly active individuals in the community. And then we also have these community conversations for those who, of course, did not get a chance to do the online survey or whatnot, and also to promote the online survey and ways to get involved. Next slide, please. When it comes to our outreach efforts, we follow an logic model based on the theory of change to ensure that our tactics and activities directly correlate with our desired outcomes. You'll see on the screen a list of tactics and for communications and outreach. We employed several newsletters and email invitations following or leading up to our community conversations to make sure that people knew about this activity. And so we sent email invitations to our list of now about 6,000 contacts. And this list includes stakeholders who live in Hornsby Bend. For social media, we promoted our engagement events and activities through social media. And we also have a robust Facebook group outreach effort where we share this time around, we shared the online survey on a variety of Facebook groups, including Hornsby Bend stakeholders. Last year, during the summer, we started a weekly email effort where we've been sharing information about the pandemic, but we've also been sharing information, the pandemic response that is. We've also been sharing information regarding the online survey and our community conversations via our weekly emails. These weekly emails go to about 600 of our most actively engaged community members, which includes neighborhood association presidents, advocates, community health champions, and advisory committee members. For the online survey, we also did a paid digital advertising campaign. We ran a paid digital social media campaign while the online survey was live and geo-targeting the zip code 78725. The campaign was in both Spanish and English. Next slide, please. As I mentioned earlier, we've engaged with neighborhood groups as well, and this was as a result of our conversations with our advisory committee members who wanted to make sure that we were reaching out to these specific neighborhood groups. So we reached out to Kennedy Ridge, Chaparral Crossing, and all of the different neighborhood groups that you see on the screen, including the Del Valley Community Coalition. And my colleague Rachel Toranjo went to one of their meetings to have a presentation and a conversation about the project and the progress of the project. Next slide, please. As I mentioned, we've had well, we've had one community conversation, and this is the second one. In March, we shared site concepts, project timelines, and ways to get involved and provide feedback via the online survey. And we had about 29 attendees, and but since then we've had more than 400 views on both English and Spanish community conversation videos, which are on Facebook. And then today, we're having this community conversation, and the Spanish community conversation will take place at 1 o'clock today, also via Facebook Live. Next slide, please. So when it comes to the results in terms of participation results of the community engagement online survey and phone interviews, these are some of the results in terms of participants. We worked with our data analytics team to ensure our target numbers for Hornsby Bend were statistically relevant. The objective of the survey was twofold. One was to gather feedback around indoor and outdoor site amenities for the health center. And two was to gather feedback around social indicators based on the health needs assessment, which was included in the project plan. This means that we tailored the survey specific to the needs of the Hornsby Bend community. We directly sampled from our MAP member population residing in 78725 zip code to get a racially and ethnically representative group of respondents that matched our MAP enrollment MAP members. The survey was also open to online respondents who resided in 78725, but were not necessarily MAP members. Using this combined approach allowed us to hear from both MAP members and the community at large, both of whom will utilize our new facility. Having said that, for the Hornsby Bend Health and Wellness Center, we had 252 participants, as you see on the screen, completed the entire survey. And because we highly value feedback from our MAP members, thanks to our outreach staff, we made a concentrated effort to call MAP and MAP Basic members living in these communities. We picked up the phone and called MAP and MAP members. So you can see on the screen, 47% of participants were MAP and MAP Basic members, and 53% were non-MAP members. There again, these were people who completed the survey online. You can see the breakdown in terms of zip code, and as you can see, the majority of the respondents live in zip code 78725, followed by 78724, which is an adjacent zip code. In terms of race and ethnicity, in general, MAP survey respondents were of a similar racial and ethnic breakdown as MAP members residing in that zip code and as residents that live in that zip code. For example, 77% of MAP members in 78725 identify as Latino, while 74% of survey respondents who were MAP members identified as Latino. When we included the online non-MAP survey respondents, 52%, as you see on the screen, of all survey respondents identified as Latino, which is more similar to the overall makeup of the 78725 zip code. All right, at this time, I'm gonna hand it over to my colleague, Ted Burton, who will be moderating the Q&A session. And we have a few comments in via the Facebook Live. Ted?
Thank you, Yvonne, for the update. Just as a reminder, if you have questions, you can ask them via Facebook Live, via the chat. And I also don't know if we have anyone on the phone or not. I was asking that question. So do we have any? I'm looking at questions. There's a couple of comments. I'm not exactly following the comments. However, we do invite you to ask any questions, and we would be happy to answer them here during this community conversation. We will also be gathering questions that we receive and addressing comments that are posted after this live portion ends. The community conversation will be on our Facebook channel, and people are welcome to review, watch, and ask questions. We did have a couple of people that joined late, so I might just circle back to Stephanie. And would you mind just talking about the timeline, Stephanie, of this project, when it sort of officially kicked off, where we are now, and when you expect, or when we expect to break ground?
Sure. So we actually went to the Central Health Board of Managers at the end of January of 2021. They gave us approval to advance what we were then calling the preliminary project plans. There's a budget associated with this project as well that they have given a green light to. we've concluded essentially the design development phase, and we are entering into the development of the construction documents. We expect these construction documents to be complete sometime towards the end of July. While that is going on, we will be developing a solicitation for the contractor. And once the construction design documents are done, we will incorporate those into that solicitation and get proposals from the contracting community. And really excited about trying to get a contractor on board. There will be obviously a period of evaluation, and we'll have to go to our board of managers for approval. But we'd like to have that done as soon as we can. We're cautiously optimistic that in September that will be wrapped up, and be able to do some work towards an official kind of groundbreaking in the fall. We do want to be, we want the public and the community to be very mindful that I think there's been a lot of news reporting recently about inflation. There's been an increased demand on construction, both labor and materials throughout the country, and especially heightened in Austin with all of the construction going on. And we know that those are going to impact timelines for this project. We are trying to get ahead of that and are looking for creative ways to get ahead of that. And the other thing that we'd like to just make the community aware of is, there are differences in terms of utility providers in this location than some of our other sites. And so we are actively working with some of the utility providers to make sure that we can get the appropriate utility size and extensions to this site. And that is all going on concurrently. So even though there's been so much progress, I want everyone to know that there's been a tremendous amount of work behind the scenes, and it's still very much an active project in the sense that we're trying to better determine timelines.
Thank you. And there is a comment or a question regarding when will the building or the construction begin? And I know that we're a little ways out from that, but do we have a general idea or ballpark of when that would begin?
I think we would like to be in active construction, by the end of this year, but there's a lot of dependencies there. And I think we will definitely keep the community aware and engaged in this process.
And worth noting, there are also two projects that are happening simultaneously, this health and wellness facility and the one that is underway in Del Valley. There is a question regarding community engagement. It might be worth Yvonne or Rachel recapping some of and you did a good job, Yvonne, of a thorough recap of the community engagement, but also talking about the different groups and organizations that we've been working with, in addition to our ongoing advisory committee meetings, but the one-on-one meetings that we've had in some of the organizations. Yvonne or Rachel, do you want to take that one?
I can start, and then Rachel can talk about the presentation for the Del Valley Community Coalition. We've been working with very active community residents, including, if I can name a few, just a few, Tina Byram and Malia, who are very active in the Hornsby Bend area, as well as Connie Gonzalez and Lorena Cruz. Lorena Cruz has been really helpful in helping us engage with residents in Kennedy Ridge. She actually went to a few of her neighbors and gathered some phone numbers so that we could actually include those residents during the telephone interview process. So we picked up the phone and called some of the residents in Kennedy Ridge, whom Lorena thought may have not access to the online survey to take the survey, and we picked up the phone and talked to them and got them to answer the survey as well. And then in terms of some of the other groups, we shared information with them. We asked if we could come and attend their meetings. They preferred to share information via their listservs. And in some cases, we did present, like in the case of the Del Valley Community Coalition, for which Susanna Woody was very kind to help coordinate that effort. And Rachel, do you want to talk about that?
Sure, yeah. So I was able to have the opportunity to go to the Del Valley Community Coalition meeting in early March, I believe that was on a Monday evening. and was able to share with them where we were at in both projects. Did a presentation for both the Hornsby Bend Health and Wellness Center as well as the Del Valley Health and Wellness Center. That was a really great opportunity because it really allowed me to share with them, to get the word out, the survey that we had posted at the time, to be able to gather feedback from the community, to provide input from the design teams at a really important stage of design that we were in at the time.
Thank you. And also wanted to mention our partner, Community Coalition for Health. So Mia Greer and Dr. Moody, who are on the ground in the community and have been assisting us as well. Do we have anyone, I guess I'm asking Anastasia, is anyone on the phone that has questions?
There's no one on the phone.
Okay. It might be worth just doing a quick recap. I know there were some people that joined the meeting late, but Aaron and Alan, you did a really nice job of just sort of painting a picture of what the facility could look like. And one thing I think we should also address are the different health services that will be provided. We know the programming has not necessarily been set in stone, but perhaps Stephanie, you can talk about what we're at least looking at right now in terms of the services that will be provided to programming inside the facility.
Sure. So there's, the clinical services, which we believe, the clinical operator will be community care. And we have been working with them in the design of this site and the plan for the clinical services. That includes comprehensive primary care and it's a family practice. So, all ages, and community care sees all who walk into their doors and seek medical care. We do also plan on having a very robust wellness component in this site as well, integrated with the clinical operator. We have that multi-function room, and in that room can have a variety of different programming. We want to make it as flexible as possible. That includes, we hope, exercise classes, cooking demonstration, having the ability to do social events, because I think we've learned that there are residents in this community that are very isolated, especially seniors who don't have a lot of other activities in the area. We want to work with Del Valley ISD as well as other partners and making sure that we're using the space to really serve the needs of the community, especially adjacent to the middle school. We have the community workstations as well. So much of the services that are available to the community are only virtual these days. And we don't know that even with the end of the pandemic, that those services will return in the same level in person. So we have community workstations dedicated. We plan on having it staffed so that people who are not digitally savvy and need access to technology could come in. This includes assistance for food assistance, SNAP benefits, other food access programs. We want to make sure housing or a rental assistance, and we're always working and looking for new partners and helping us provide those services that close the gaps around the social determinants of health. We have a very deliberately designed driveway, and that driveway will allow us to provide what we'll call kind of drive-through event services. And I think you've seen that a lot during the pandemic, but we see that as a really great way to continue to be able to serve the community, whether that's food or back to school events. And obviously the vaccine has been something that we've learned can be done even in the car. So the kind of circular driveway, making sure that there's traffic on both sides, it will support traffic on both sides, and kind of using that Gilbert Road as part of our driveway essentially has been deliberate in the design. I'm not sure if there's, Ted, if you wanted me to elaborate on anything.
Well, no, I think that's great. And I know Alan did a really nice job of explaining how this is going to be a community space, a community destination. So with public spaces both inside and outside. And I know Mike Giesland is on the call. And Mike, we had a question via Facebook regarding funding. And do you want to address how this project is being funded. And again, re-emphasizing that the goal is to break ground on this facility by the end of the year. A lot of moving parts happening between now and then, but that is the goal.
Right. Certainly, and want to thank everybody for joining us on Facebook Live today. This is an important milestone for the community, and we're thankful that you could be here with us today. So to address the funding issue that Ted had mentioned, right now, and you heard earlier that the board had provided preliminary approval, or excuse me, approval for preliminary budgets back in January, and that's where we are right now, and what we're working with. For Hornsby Bend, the estimate to build and construct back in January was a little over $5 million. Now, obviously, that's going to be subject to change, probably increasing because of increased construction, not only materials costs, but also labor costs. And so, that is a very preliminary figure. We anticipate that increasing. But that's to get the facility up and running. Now, keep in mind, we've already purchased the land, but the other is ongoing operating costs. And so, for the first couple of years, we estimate it could easily be anywhere from $750,000, probably upwards of $1 million in additional operating costs to offset what it is to bring a clinic online. So there's the building piece of it, and there's the operating piece of it. But then as you get into the years beyond, looking at what our funding commitment is through the medical access program, and continuing to reimburse for healthcare for those that are funded through the medical access program. That's both MAP as well as MAP Basic, which is a sliding fee type scale program. But then community care, or whomever the clinic operator is, right now that's who we're working with is community care. They also receive funds or reimbursements rather for patients that are covered under other programs such as Medicare and Medicaid. As well as other sliding fee scale and private pay insurance. So there's a number of funding sources that will be coming into this clinic to reimburse for patients' care. And so we look forward to continuing these discussions, especially around the programs and how they evolve as we break ground later this year and work on getting the clinic up and running.
Thank you. Stephanie, you wanted to add something?
Sure. I just want to make sure everyone knows that, originally we thought we were going to finance the construction with our kind of operating cash. We have a capital program at Central Health, and we kind of have saved up and budgeted money for these clinics. What we have other projects are also in the works. And so I think there has been, some awareness that we may go and issue debt. And really what that is a way to kind of save our cash. We expect that if we go forward with the issuance of debt for this project, that we will probably continue to need some of our operating reserves essentially for these projects. But it helps us just keep more cash, just like, you might finance a car, or you might, want to mortgage your home. Just gives us a few more options and keeps more cash kind of in our reserves. But I want to assure the public that these projects are funded, and whether or not we debt finance them or use our capital reserves for them is really an operating question.
Thank you, Stephanie.
The decision of our board.
Thank you, Stephanie. Also, if you are watching via Facebook Live, we would invite you to be part of this process. And Yvonne had mentioned earlier, there are a number of ways to stay up to date, share your voice, your opinions, and your input. And we have, as he mentioned, we have regular email communications that provide updates on the project. We do surveys, we have done one-on-one presentations, and I would assume that we will be doing more of those as this project moves forward. And we also have community advisory committees for people who want to be involved on a regular and consistent basis, where we meet approximately bi-monthly for both the Hornsby Bend project and the Del Valley project. So if you share your contact information with us, we'd be happy to connect you to make sure that you stay in the loop and are provided regular and consistent updates. With that, I don't think we have any more questions or comments to address. Just going to see if anybody has any final thoughts before we wrap up this conversation. And just a reminder, we will be doing a community conversation in Spanish today at 1 o'clock, and we would invite you to join that conversation as well. Does anybody have any closing thoughts or anything that we didn't address? Mike?
Yes, and again, I want to thank the community for their input, their guidance, their patience throughout this whole process, starting from when we first purchased this property. And I think the vision that you see here on the screen right now, it starts to bring it in more and more closer to reality. I know that Rachel and Stephanie and Yvonne and Ted and Anastasia and others have worked tirelessly, and many others that are not on this panel right here that worked tirelessly to bring this project forward. And there's still a lot more work to do, and there's still a lot more community engagement. So I want to really emphasize what Yvonne, Davila, and Ted have brought up, which is to continue to stay engaged and tune in to the meetings that we have. And when we go out for surveys, please respond to the surveys. That's vitally important to us. But also the last closing comment that I'll make is that, when you think about health and wellness, and you think about what happens in an exam room or at a place like this, there's so much that we can do that positively impacts people's health that's even outside of the clinic. And that's a much bigger conversation that we look forward to having with the community when you start thinking about social determinants of health and how we use that community space that's been designed into this building to positively affect individuals' health and families' health as we partner with the community from now till time immemorial. So again, there's a much bigger conversation to be had about health and wellness beyond what you see here on the screen. We look forward to having that as well. Thank you.
Thank you, Mike. There was one question in our comments asking if there are future conversations scheduled. And I don't believe we have any future conversations scheduled yet, but there will be more of these community updates. We do have a community conversation, I believe it's June 17th, correct, Yvonne, about our strategic priorities and budget priorities for next year. So we'll be sending out invites to that and publicizing that as far and wide as possible. We invite everybody to participate in that community conversation as well. And we will have more project-specific updates in the future to keep everybody up to speed on where we are, both with this facility and the Del Valley facility.
Ted, I do want to mention, yes, thank you so much. And I do want to mention that we will be focusing more and more on going to each of these neighborhood groups that I mentioned earlier. So bringing this presentation to the neighborhood groups, like I mentioned earlier, with Kennedy Ridge, Chaparral Crossing, Phase 3 Austin's Colony, Forest Bluff, AC River Creek, and others. So just like we did back in March and April, around the time the survey was open, we will be going back and sharing all of this information with each of these neighborhood groups as well. If anyone that's watching now has any thoughts about other neighborhood groups that around the area that would like or would be interested in hearing this information and in staying involved, then please drop it in the comment section of the Facebook Live, and we'll be more than happy to reach out. Thank you.
Thank you so much. Thank you, Yvonne. Thank you, everybody on the panel. More importantly, thanks everybody for watching. This will be continue to live on our Facebook page. And so we encourage you to share the link, and it will be there forever. So it'll be available to watch and respond to. And again, if you have questions and comments, our team will review those and answer those and address those and send those out. Thanks everybody for being here. We appreciate it. We'll see you at 1 o'clock.